Hey everyone, Dr. Ryan here, and in this instructional video sponsored by Colgate, I'll be talking about PreviDent Varnish, its indications, contraindications, and proper use in the dental clinic. So PreviDent 5% sodium fluoride varnish is a topical varnish applied by a dental professional for the treatment of dentin and postoperative sensitivity. While it's officially approved by the FDA for treating dentin hypersensitivity, we know that this high concentration of fluoride in the varnish also strengthens our enamel, helps to rebuild demineralized areas, and provides long-lasting protection against acid attack, all of which are critical for preventing tooth decay. Note that hydroxyapatite can also remineralize tooth structure, but it won't provide the same fortification that fluoride does. So fluorapatite is more resilient to acid attack with a critical pH of 4.5 compared to 5.5 for hydroxyapatite. So just something to keep in mind, fluoride does a better job of protecting your teeth in the long term. In addition, at low concentrations, fluoride is bacteriostatic by interfering with bacterial enzymes, and at high concentrations, like in this varnish, fluoride is bactericidal, killing harmful bacteria altogether. There are many fluoride delivery systems out there, and I thought it would be really helpful to include them all in this table. And so we have varnish, we have acidulated phosphate fluoride or APF gel, we have prescription strength home use toothpaste, and mouth rinse. Now, where some confusion comes in is the different ways to represent the concentration of fluoride, which is in the columns here. So I'll explain this a little bit. Each number across each of these rows here is actually equivalent. So for example, a 5% sodium fluoride varnish, like we have here with PreviDent, is the same as saying a 2.26 fluoride ion percentage, which is the same as saying 22,600 parts per million of fluoride ion. Likewise, a 2.72% sodium fluoride gel is the same as 1.23% fluoride ion or 12,300 parts per million fluoride ion gel. A 1.1% sodium fluoride toothpaste, like PreviDent 5000 Booster Plus, is the same as saying 0.5% fluoride ion or 5,000 ppm fluoride ion, hence the name PreviDent 5000 when we're talking about that prescription strength toothpaste. By the way, in bold are the numbers usually featured on the package of each item. So the varnish is usually 5% sodium fluoride, the gel is usually 1.23% fluoride ion, and the toothpaste 5,000 ppm. Anyway, hopefully that clarifies some of the different numbers being used. And currently, the ADA recommends these concentrations for people at risk of developing dental caries. So again, any of these numbers, you just match it up with the description that it's telling you, either percent sodium fluoride, percent fluoride, or ppm fluoride. And as far as the mouth rinses go, there's a range that's allowed, and the ADA specifically recommends the 0.09% fluoride ion mouth rinse for someone as long as they're 6 years or older and at risk of developing dental caries. So some contraindications to using the fluoride varnish. There's a component in there called a colophony or rosin, which is a contact sensitizer. And essentially what it does is it makes the fluoride varnish sticky. And direct skin or mucosa exposure to this rosin from the varnish is usually not a problem at all. It's usually not an issue whatsoever. But in a hypersensitive person, it might initiate an allergic contact dermatitis reaction if it's on the skin, or stomatitis if it's on the mucosa. And there are currently only 2 reported cases in the literature of this. Although it's extremely rare, we do recommend performing a thorough health history to determine any known allergies prior to using the fluoride varnish, just like you would before the administration of any therapeutic agent. And considering this rare but potential reaction, fluoride varnish is contraindicated when ulcerative gingivitis or stomatitis is present and should not be applied on large open lesions. I also feel it's important to mention this. Yes, fluoride is technically a neurotoxin, but only in extremely, extremely large amounts. It's also a naturally occurring element, and even too much water can be lethal. So in the same vein, too much fluoride, yes, is a problem, but in these doses that we're talking about, it is not in that range whatsoever. That being said, to be responsible when PreviDent varnish is applied, other fluoride preparations like fluoride gels should not be administered during the same day. The routine use of fluoride tablets, if those are being used, should also be interrupted for several days after the treatment. So let's go step by step. Step number 1 of applying this varnish is to clean, wash, and dry the tooth surfaces with air or gauze. Why do you want to do this? Well, the fluoride varnish adheres best to a dry surface. Moisture that's already present on the tooth from saliva or water can dilute the varnish as it's being applied and reduce its ability to stick to the enamel effectively. Step number 2 is to mix the varnish. It's important to mix well prior to application so the varnish is the proper consistency. And next, we apply the product. So the varnish is painted onto the front, the back, the top, the bottom of all the teeth in a thin layer with the supplied brush. And generally speaking, you do not have to paint it carefully. You can just swipe it everywhere, get it on all of the tooth surfaces. And once the varnish is applied, the beauty is you don't need to worry about moisture anymore. In fact, the varnish forms a sticky covering over the tooth and becomes hard as soon as saliva touches it. And this is a unique property of fluoride varnish, enabling it to stay on the teeth for several hours, slowly releasing fluoride to strengthen enamel and protect against decay and make teeth less sensitive. So step number 4, after applying as much as you can with one brush worth of varnish, wipe any excess before redipping it to keep the brush from getting too stiff. All in, it should take no more than 2 minutes to varnish all of the teeth. For patient instructions, since the varnish hardens on contact with saliva and also dries to a natural enamel color, the patient can leave immediately after application of the product. However, these are 2 important instructions that I would communicate to the patient to achieve the maximum benefit. So for the next 2 hours, they should eat only soft foods, and for the next 6 hours after application, they should not brush, floss, or drink hot liquids. So it's best actually to wait until the next day to return to a regular oral hygiene routine. And if there's any of the varnish left on their teeth at that point, brushing will take care of it. Their teeth will look and feel just like they did before treatment, but they will be protected by the fluoride varnish treatment. That's it for this video. I hope you found it informative and helpful, and I'll see you in the next video. Thanks so much for watching.